Chain Drug Review and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello, everyone. I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today, we're thrilled to have as our guest Kevin Host, Senior Vice President of Pharmacy at Walmart. Kevin, welcome back.
Thank you so much, Jeff. Appreciate being here.
Today, we want to talk to you about your experience as NACDS Chairman. You took up that job a year ago. You will relinquish it at the end of this month. What stands out?
Oh gosh, I think there's so many things that stand out. It was a busy year, and first I'll say I was just very honored and privileged to have an opportunity to sit in this seat. The organization has been around for 90 years, and it's been a great advocate for our profession and our professionals. And I think what stands out is just the push for PBM reform. So despite what seems like constant setbacks and challenges, NACDS has just really been unwavering, and the members have been unwavering. So we're going to take another stab at it again this year. And, I feel just even a renewed commitment and energy around that. And similar to PBM reform, scope of practice for pharmacists, we've got a shortage of primary care physicians in this country that's only continuing to grow. And, pharmacies are accessible to virtually all Americans. And so better access to care and convenience for our communities is what we're pushing for. But it takes the states to change that scope of practice, and takes the government to enable provider status in order for our seniors to get access to those services. And so, NACDS has been incredibly nimble and flexible, but we've always been able to navigate it in a way that it's very bipartisan. And so we continue to push forward. I would say those are the things that are always top of mind. I mean, beyond that too, the organization just continues to be creative. So thinking about new innovations in nutrition, over-the-counter strategies, testing, further synergies around new things, not necessarily new, but things like dermatology, beauty. So there's been a lot to answer your question.
Let me drill down on a couple of the things that you talked about. You indicated that there is a lot of support in Washington for PBM reform, particularly. What's it going to take to just get it finally over the finish line?
I think there's a lot of understanding now, thankfully, around the underlying themes of PBM reform, which is transparency, fair reimbursement, and even just oversight. So much so that in the new Congress, we've seen six bills recently introduced in the House and the Senate that include some form of proposed PBM reform. So to us, that indicates that the momentum is growing. And then similarly with provider status, we're seeing a lot of momentum gaining in the states as well, and that's very encouraging. So, at the end of the day, NACDS has had a 90-year history of working with all sorts of different administrations, both parties. And so I think it's really imperative, though, at this point in time for Congress and both parties to just continue to press and get the federal reforms done that we need. Pharmacies are closing at a rate of nearly 4 per day right now, according to the NACDS, and we can't have that. Pharmacy is a beacon in terms of healthcare access.
Kevin, I know it's early days, but is there any indication of where the Trump administration stands on PBM reform?
We've heard the president make comments that we would interpret as pro PBM reform. So I think we're hopeful. And again, I think when it comes down to the Congress, we see a broad bipartisan support. We know we have a lot of understanding about this issue across both parties. And so, at the end of the day, we're going to continue to lean in with this new administration and continue to answer the questions, provide the information that we can to help support these efforts.
You mentioned nutrition, and NACDS has embraced the idea of food as medicine, along with many of its members. How do you expect that to impact what goes on in the pharmacy?
Nutrition is central to all healthcare. I just think back to pharmacy school. When we were going through pharmacy and therapeutics, often a lot of times it was diet and exercise was the first thing that we were taught. And so pharmacists have been providing nutritional recommendations as part of a patient's journey for years now. And I think never has it been more important, as there's increasing amounts of information available on social media and on the internet generally. Sometimes it can be overwhelming and even confusing for customers and patients. And so here again, pharmacists are there. They're in those communities with those patients as they're shopping and making food decisions. And so some of our pharmacies are right next to the fresh produce and those food aisles. And so, our pharmacists need to be enabled to provide that kind of support for our patients and assist them on their health journey. And so, we're looking at how do we enable pharmacists to provide more of that care when patients are expecting more from their shopping experience.
And you mentioned several other areas that pharmacy has opportunities in. Which of them most excite you? Do you think have the most promise?
There's so many. And I think of, what we've done at NACDS is we've created health and wellness innovation initiatives. And so, the idea behind that is that we need to continue looking for opportunities that are pro-patient, pro-pharmacy. And so one example of that is where we've looked at creating new opportunities for screenings, blood pressure, diabetes, cholesterol, and doing that through pharmacy. And in many communities, we have that enabled. But I do think that there's some space for pharmacists to play a role in chronic disease management as well in the future. And so a lot of that will take more collaboration with providers, with medical doctors and nurse practitioners, physician assistants, and kind of at the core of that too is just data interoperability. And here again, NACDS is working to advance data interoperability for pharmacy such that we can play a more essential role in advancing, outcomes and care for our patients.
Are you hopeful that will happen soon?
It's been coming along, albeit sometimes it feels like at a snail's pace. I know my own experiences when I graduated pharmacy school, I couldn't even give an immunization legally. But here we are, fast forward 20 some odd years later, and pharmacies and pharmacists give a majority of the immunizations in this country. Testing and treatment, same is true for that as well. Couldn't even begin to think to do any of that when I first graduated. And now we have 21 states that have enabled that level, that scope of practice for our pharmacists. Mm-hmm. And so it's encouraging to see that.
Kevin, one other area of great opportunity, but I think also great challenge is specialty pharmacy. What role can NACDS play in helping its members understand that field and get established in it?
Yeah, absolutely. I think specialty pharmacy was long ago kind of carved out by the PBMs, carved out of the retail setting or the community setting. And so as we talk about PBM reform, what we're really pointing to there is just increasing access and sustainability of local pharmacies, and specialty pharmacies part and parcel to that as well. And so while sometimes you may not see it called out in bills, it's absolutely what we're pointing to in these efforts. So specialty pharmacy consumes a disproportionately large amount of healthcare dollars, and yet the populations that need those drugs are relatively small. And so the stakes are high, and patients need access, just like everything else. They need access to those drugs, to that specialized care, and oftentimes they need that in their community, which is why, at Walmart, we have our specialty pharmacies of the community. We have over 100 of these now, and it's almost a store within a store concept. But where we have needs in local communities, we provide additional training certifications for our pharmacists. We provide Same thing for our technicians. Sometimes we go as far as to provide community health workers and try and engage around those disease states and those therapies where they may not have access otherwise. And PBM reform is going to be key to helping to unlock access to that care as well.
Final question for you, Kevin. How do you anticipate your experience at NACDS and leading the organization influencing your approach to Walmart's health and wellness business?
At Walmart, we always look at it as an opportunity to bring Walmart's mission to life, and specifically that promise to help people live better. And so a lot of time, throughout our history, we've done that through helping them with affordability and access to fresh foods and affordable merchandise. But now increasingly pharmacy has become and playing a critical role to that as well. And that's our priority, really, just to do that. So, I spent this last year just learning from all my colleagues across NACDS, and I've had a front row seat to how how NACDS advocates for the profession. And it aligns very, very closely with what we do at Walmart. And so I kind of break it down into focus areas. We want to make healthcare more convenient. We want to build trust with our local communities. We want to increase access to care and improve drug affordability. And I would say that, across NACDS, everybody would probably just ditto that. We're all trying to improve the healthcare of Americans. But one of the examples, I think, for Walmart specifically is that we've launched same-day delivery service, and we've mixed that into our e-commerce business in a way that patients can now get their fresh food, groceries, general merchandise, and their prescriptions all in one experience, all in one trip, and they can get that at their door same day. So if you think about caregivers that may be on one side of the country taking care of patients on the other side of the country, they can actually utilize that to send food and groceries and the prescription to their parents' doorstep if their parents may not have transportation. We get letters all the time on this. I recently had one from a patient who actually had brain surgery and couldn't drive anymore. They were obviously very thankful for this service because they were able to get their medicine delivered to their door and didn't have to leave the house. And so we're just going to continue to make investments in technologies that improve the care experience for our customers, but also in a lot of ways, more importantly, enables our pharmacists to just spend more time with our customers addressing health needs. So it's been an inspiring year. And I've been doing this for a long time now. I tell people all the time that community practice to me is pharmacy practice. It's where I grew up. It's why I went to pharmacy school. And it's why I've spent the better part of my career trying to figure out how to bring more care to patients in communities. And so Walmart's been a great opportunity to do just that.
Yeah, it's exciting to see what you guys are doing. And let me say, I think I can speak for the entire industry when I say thank you for your service and leadership to NACDS and to the pharmacy profession.
Well, thank you so much, Jeff. It's been an absolute privilege and honor, and it's been an awesome year. And I couldn't do it without just all the support from NACDS and the wonderful staff there, as well as the members of NACDS. They say a rising tide floats all boats, and America has never needed it more than now. So we're all in it together.